On today's All Things Heart, she was in her 60s, but barely able to walk without terrible discomfort. Surgery was not a good option, so we're going to show you the alternative she found here at the University of Kansas Health System. Good morning, I'm Alexis Del Cid. Welcome back to All Things Heart. Our word today is detour. It means a longer or roundabout way to take to avoid something else. So it's fitting that detour is also the name of the procedure that changed this patient's life. For years, she was plagued by atherosclerosis affecting the arteries in her legs. She had terrible pain and muscle cramping, causing her to feel decades older than she actually was. Today, that is no more. She has her life back, and we are so happy to welcome that patient, Tammy Hosseinmostafa, in the studio today this morning. Thank you for being here.
Thank you.
And we have her lovely husband, Reza. Thank you for being here.
Thank you.
And we also have Tammy's vascular surgeon next to me, Dr. Axel Thors. And we have Alex Jepson. Alex is a cardiovascular technologist who's always assisting Dr. Thors in these procedures. It's great to have you on and have your perspective this morning.
Happy to be here.
Tammy, I want to start with you. How are you feeling physically today?
I'm feeling great. All my symptoms related to lack of blood flow are gone, and I'm enjoying life again, so I'm doing very well.
And Reza, what's it like to have your wife back to full capacity?
It's very exciting. You know,
yeah.
She's back doing normal thing that she used to do, and I'm very pleased about that.
What's the biggest thing you've noticed mood-wise?
Well, she's happy.
Happy wife, happy life.
Yes, that's exactly right. And we really enjoy life now together. We plan stuff that we could not do before, you know.
Because you enjoy traveling and doing all sorts of things.
Well, we hadn't had a chance yet, but we like to do that.
Tammy, I want to show some pictures because it looks so painful. You shared some pictures of your foot that were taken 10 years ago. This is before you had any surgeries or procedures. What's happening here? This was when you were first diagnosed with peripheral artery disease. That looks so painful.
Yes. At that point, it was extremely painful. I felt like I had burns all over my foot, like a very bad burning sensation. And I think at that point, my artery was completely occluded, and just my foot was ice cold, but barely a pulse in it.
And painful?
Very painful. It hurt just to put my weight on my foot to walk. And
so how were you able to
I just
get
had
around?
to basically, this was about a month before my first procedure, so I just had to basically just rest and not hardly do any activity until the procedure.
Dr. Thors, what was Tammy's official diagnosis?
Tammy had a form of atherosclerosis, hardening of the arteries. However, her situation's also compounded by previous surgery for cancer in her leg, requiring radiation therapy. So I think that the radiation therapy really accelerated the disease in her vessel and led to these occlusions, and more importantly, led to very difficult to treat occlusions in the leg. So she had a fairly unique case in that sense.
From cancer treatment for your leg, that happens. We hear a lot about the side effects of different treatments. How long had you been in this discomfort, this pain of not being able to walk?
It really, it's about 10 years ago I was diagnosed, but 8 months before that I started noticing symptoms where
So you're in your 50s?
Yes, I was around 56, and just started noticing a lot of fatigue in my calf muscles and then pain. And I noticed that a lot that spring that I was outdoors doing a lot of landscaping and gardening, and it was just so painful. And that's what's prompted me to then go see my doctor.
You saw your doctor. And Dr. Thors, how does peripheral artery disease relate to atherosclerosis then?
Yeah, so you know, really the disease on the inside of the blood vessels, you think of these as just plumbing, just like your house. If the plumbing gets a clog, then your muscles are going to, or your body's going to tell you some of the the symptoms of that. In her case, as she mentioned, when she walks, she gets cramping in the muscles, and that's just a supply and demand issue. When she's trying to walk, those muscles are demanding more blood flow, and it just can't get there efficiently because the pipes are blocked. And that's the disease pattern, whether we're talking about heart disease, whether we're talking about peripheral arterial disease in the legs. It's the same pattern of disease.
And it's all one system of plumbing.
It really
So
is
it's
all one
gonna
system
affect
of plumbing. It really just depends on where the vessels are leading and how important the organ is, you know, as far as what manifests.
And what did you notice, Reza, about Tammy? When did you notice that she was starting to really struggle?
Well, basically, she had a hard time, you know, walking, or she had pain on her
Time
calf.
out. Are these your wedding pictures here?
Yes.
I have to, what a glamour. Is that you busting a move?
Yes.
Are you kidding? You look so glamorous. Okay, so we're watching your courtship, and clearly you're an active couple. You love dancing and doing things. So, forgive me for interrupting, but you started to notice.
Yeah, and she would basically go upstairs. She had to, wait for, a few minutes or something like that to come down or walk, She was basically in pain. That's when I noticed, yes.
Dr. Thors, what exactly is the Detour procedure? And walk us through, we're going to show some illustrations, what you're doing during this procedure with Alex. And Alex, we're going to get to you in a second as well.
Yeah, so the Detour procedure, in her particular case, I felt that this was one of the best options for her, just given her disease pattern. And what this does is exactly what the name sounds like. We are going from her artery, which is where the problem is, and we are using the vein that is right next door to the artery, and we're basically placing an internal bypass through the vein, bypassing the blockage, and then re-entering the artery. So you can see on the schematic there, the white part is the stent that ultimately goes in to restore flow, and it is going from the artery into the vein, around the blockage, and back into the artery, restoring flow beyond the area of blockage. So you're just basically replumbing the pipe by taking a detour through the vein.
Okay, and what's the stent made out of then?
Stent is made out of a special metal called nitinol. So it's a nickel alloy that as it heats with blood is body temperature, so as it heats it expands, and then we also spend quite a bit of time ensuring that the sizes are appropriate for her vessels. They're unique to every patient.
I always wonder this when we're looking at illustrations like that. So in the illustration, when you take it for how big it really is, like compared to my pen, how big is that stent?
Yeah, it would be not much bigger than that stent.
But about this long, and that's what's in?
Oh, no, it's much longer than that.
How long is it?
We're talking about a stent about this long, about.
And where in her leg is it?
So from the upper groin area down to just about the knee.
Okay.
So, groin crease to the knee.
Alex, what's your role during the procedure?
So I'm the endovascular scrub tech, or working cardiovascular as well. So I'm sitting there at the table with Dr. Thor scrubbed in at his shoulder, helping prep devices, run the table, inject contrast dye, which allows us to visualize the soft tissues under X-ray or fluoro, handling anything, and I'm also an extra set of eyes whenever we're deploying devices or looking for blockages.
Alex has such an interesting journey. We were talking before about how you came to this, and you did other things in your career, but you were always drawn to medicine. Did you know it was going to be? You said you'd also worked with some building and some construction. You've done all sorts of things. Did you know this would be likened to plumbing as well?
Not really, but it was a funny little transition. We talk about the endovascular being the plumbers, EP electrophysiology being the electricians.
Yes.
I was an electrician for a while, and now I'm a plumber.
Right. So compared to other procedures that you do, with the Detour procedure, what stands out to you most about the invasiveness or lack of invasiveness with this?
So I don't do much in the way of the big surgeries where they're actually doing open bypass, harvesting from a different point in the body, and then taking those harvested or synthetic grafts, putting in to do a bypass with a cut down, meaning opening up. I do everything percutaneously, endovascular, so we make if anything, a small incision. Usually it's just a big IV. We run all our devices through there. But seeing scar tissue, grafts that have gone down in the past, seeing the kind of trauma to the tissue when we're doing those actual cut down procedures, this is significantly better. We're making a small incision or a small IV in the ankle and then the groin, and that's really it. From that point on, everything's done inside the body. There's no exterior trauma. It's very simple, well, not simple, but very streamlined.
How long was the procedure, Tammy? What's the last thing you remember before the procedure?
The procedure was about 6 hours, but I believe there was some prep work had to be done on my artery too, because of the artery had occluded.
By occluded, you mean for a non-medical audience?
It was like 100% blocked with
yeah.
heavy calcification lesions. And
so what's the last thing you remember before going under?
I just remember looking around the operating room and seeing a lot of people, but I went out pretty quick. I was surprised how quickly I went out.
And Reza, where were you for the whole procedure?
Well, when we went to the hospital, basically, I was with her before they take her to the operating room. And then after that, I basically were in the waiting room.
Is that you?
Yes.
Why'd you shave your beard? Just decided to get a new look? You look good either way. You pull off a beard really well, too. So how did you feel about having your picture taken while you're in the hospital?
Well, actually, this one is from my first procedure that I had. So yeah, we were sending it home to family overseas.
You say we're okay
not
here.
always the best views.
How many procedures did you have leading up to the Detour procedure?
I've had 5 revascularization procedures over the years. And
Dr. Thors, what made you think that this one would work? I remember you said you were starting to feel despair. Like, oh, there's nowhere else for me to go after this, right?
Yes, it seemed like the minimally invasive procedures wouldn't last, and I wasn't looking forward to if I had to have open leg bypass surgery because of possible complications in the recovery. So,
did you say open leg?
Open leg bypass surgery.
We hear of open heart bypass surgery.
Yeah.
Open leg bypass surgery.
Same thing, just in the leg. So it's maximally invasive, where we're rerouting things by making large incisions. In her case, given the previous surgery, radiation, I felt like that is still an option, but I felt like that was not the immediate option. And some of those procedures that she mentioned, I had done several of them, right? Or at least 2.
The shockwave IVL procedures.
We were hopeful. She has a lot of calcium within her vessels, and that makes things very challenging to deal with. And so I was hopeful with some other technology that would work for her disease, and her vessels proved otherwise. So, and that's where Detour came in, and hers was, the procedure itself is not usually 6 hours. Hers was exceptional in that it was a lot more challenging. But
because your body has been through a lot of trauma, beginning from when you were little, and you had cancer in your leg.
Yes, yes. And
what was your recovery like from this Detour procedure?
It was very similar to having an angioplasty procedure. I spent the night in the hospital and was released the next morning. And I did have a fair amount of swelling at the beginning, so the first few weeks I would keep my leg elevated above my heart when I was sitting and wear compression stockings. But within 4 weeks I was back on the treadmill exercising.
Beautiful.
So, yeah.
That's great. We do have some questions coming in and some comments coming in. So if you have a question you'd like us to read out loud or a comment on the program, you can send it to us right now on YouTube, Facebook, or the All Things Heart email. All those links are right there on your screen. Tammy, when you wake up now, what does it feel like compared to when you would wake up 10, 15 years ago?
Oh, well, I'm just enjoying life now. I'm getting very used to feeling good like this.
That's a good feeling.
Before, I would have a lot of severe cramps in bed at night when I was sleeping, and I never knew when it was going to happen. Some nights I would be up most of the night, with that. So now I wake up, I feel good. I haven't had any cramps since then. I don't have that heavy fatigue feeling in my leg just doing things around the house. And I can go out and do errands and shopping, and I feel great.
Oh, so fantastic.
So, yeah.
Alex, from the technologist standpoint, the cardiovascular technologist, you mentioned and Dr. Thor's talked about the non-invasive nature. You talked about 2 incisions, the ankle and the groin.
So as Dr. Thor says, we go in on the arterial side and the venous side. So the ankle is the venous site, so going in through the vein, run the wire up to just past proximal to where the blockage would be, and then on the arterial side through the femoral groin, going down to the blockage, and that's where as he said, we would meet, cross over. We snare that wire, so it's you're essentially lassoing it, being able to pull it down through the artery, or excuse me, the vein from the artery, till we get past where the blockage is. Then we go back through and deliver the device.
It's wild. The way you describe it, it is like fixing a plumbing problem. You're not lying. Didn't think you were, but I love that analogy. We just showed a drawing of something on the screen. What was that we just put up? Was that a picture of the
so this
stent, or what is that?
This is the delivery device,
Okay.
and you can see the thing that is pointing out of the device is a needle. So the needle actually has to go through the artery into the vein, and that needle is hollow. So through that needle, a wire can be passed, as Alex was explaining just now, to gain access from the artery through the vein, back through the vein into the artery.
Tammy had said she felt like she was out of options until she discovered this procedure. How did you come to realize that this would be a good procedure for you? Did you approach Dr. Thor saying, what about the Detour procedure? Or did you approach her saying, I've got an idea?
Well, I had read about it online, and I had an appointment scheduled with Dr. Thor's, and I talked with him about it, asked him about it, and so he said he would look into it and see, because I guess the procedure isn't for everyone. You have to meet certain criteria for the procedure.
What would have made Tammy not a good candidate for this? She was, but in what case would you say no?
It all really comes down to anatomy. Where we do and do not want to place stents, typically across joints, for example. So if her blockage extended below the knee, that can still be done, but is fraught with a lot more risk.
Because you're constantly bending
you're
the stent.
constantly you can imagine a paper clip, and you're continuously bending that. Eventually it will break, like any metal. So so anatomy really is what determines candidacy for this. We have to be able to access the arteries both on both sides. We have to, the veins have to be accessible, so if we can't deliver the devices to the location and we don't have an area to land above and below, then you can't do the procedure. So it really is 100% anatomy.
Reza, do you remember the first thing Tammy said to you when she woke up?
Not really.
No? How nervous were you?
Well,
husbands are always so nervous. They're the quiet, nervous ones.
Yeah,
right?
I was nervous while the procedure was going on because it was taking longer. I used to like hour and a half procedure, and this time took 6 hours.
So it's a lot of waiting.
It was a lot of worriness and kind of didn't know what's going on.
Now here she is. Look how gorgeous your wife looks now. She's back. Tammy's back.
Yeah.
Alex, I do have a quick question for you. As the technologist, how do you confirm, what are you seeing that confirms that the blockage is done and the blood flow is flowing and the pipes are clear?
So as I said earlier, is soft tissues like veins and arteries, they don't really show up under X-ray or fluoro, which is live X-ray. So we use a power injector that we can push contrast dye. It's just something that has higher attenuation, so it absorbs more X-rays, so it will make those soft tissues show up. So we'll inject it, make sure we are at the blockage, past the blockage, wherever we're at, and then we use it throughout the procedure to check our work, see where we're at, see how far we are, and then at the end we will see, we'll do a big injection of the whole leg to make sure that we have blocked off everything that needs to be blocked off, made sure those stents and bypasses are secure, as well as that we've got flow from the proximal to the distal.
We have some great pictures of Tammy and Reza that we want to show. It's just you out and about, enjoying your life. What are some of the things that you love doing most? Reza, I'll start with you. What are some of the things you love doing most now that you couldn't do when your wife wasn't feeling well?
Well, before we always had to plan anything that we want to do, any event that we wanted to go. We had to see if there are stairs to get to that building, or parking lot is close to the building, stuff like that. But now it's much more spontaneous, let's put it this way. Yeah.
The spontaneity's back.
Yes.
You can just decide to go somewhere for a walk or a hike.
Yeah.
And Tammy, what's on your bucket list now that you're feeling better?
Well, I can dance again, which
Yeah, we saw the dancing
I haven't
pictures.
had a chance to go out and do that again. But one thing we always like to do, landscaping and gardening and these things in our yard. I haven't been able to do that for a long time. So I'm looking forward to warmer weather and doing all that. And actually, I was the one that always used to mow, and I actually look forward to being able to mow.
You like mowing? Lucky guy. How did you land a wife that likes mowing? Fantastic. You hit the jackpot, Reza. We have some questions that we want to get to, so let's go to some of our community questions and our comments. Jeremy has a question. He wants to know, how do you decide the strategy of making a detour in the vein like that? Like a team discussion, or are certain areas of the body just better for it in general? You touched on this in a little bit, but can you expand on that for our viewer, Jeremy?
Yeah. Again, as stated, it really comes down. Each case is individual. This isn't a rubber stamp. Everybody gets this. You can just come off the street, and it fits every anatomy. So. 80% of the work is done before we ever go to the operating room. And so it takes a lot of planning and consideration to be a candidate for this. But the prep is really in the preoperative imaging, understanding the anatomy, making sure that those factors that I mentioned earlier are true.
Becca wants to know, is this a rare procedure? How common is it?
This is a new technology, to be clear. So this hasn't been around for many years. Now, any technology is always vetted for many years prior to it becoming available in the market. But this has not been around for more than 5-6 years, and so. When
you say new technology, is it a new stent or a new way of placing the stent, a new? Good question.
It's more the technology of placing stents and wires and that sort of thing is not a departure from what we do normally. The delivery mechanisms and the devices, as you placed on the screen earlier, that allow us to cross the artery and the vein, and the stents actually are designed for this purpose. They're a little bit different than the traditional stents we would use in other locations. So they've been specifically designed for this purpose because of some of the anatomic details. So the procedure that the companies have innovated to bring us to this point and have really studied this issue. And is it common? Yes, it's readily available. It's available here at the University of Kansas Medical Center, and I'm sure other places, but is it for everybody? No.
Right. As a technologist, Alex, when you have a newer procedure or a newer way of doing things, how often do you have to do this continuing education to keep up with all the new things that are happening? We know doctors go to conferences and stuff. What about you?
It is very much a regular learning opportunity. We have reps that come in from the different companies, different devices. They'll do training sessions in the mornings before we start. Sometimes it's scheduled, like with the Detour device. They came in a couple days before, made sure that we had everything down pat, know how to deploy the device, prep the device. Then also while we're in the case, usually one of the representatives shows up and is in there giving technical support, suggestions, things like that for the device. So we're even if it's something that we may have not touched for a month or two, we've always got some sort of font of knowledge that we can tap into to make sure that we're doing the best for the patient, best for the device, best for the procedure.
And are you and Dr. Thors a duo? Always you two working together?
When he's down at the Olathe campus, usually.
Okay, so he's...
Pretty commonly. And I'm not upset about that. Yeah,
right.
yeah.
You were saying how much you admire Alex and how
Alex
much you
is
like working
awesome.
with him.
And you know, it makes a big difference. Somebody that you work with quite often, that knows the next move, that knows you know, the flow of the case, and also is another set of eyes, like you mentioned. You know, I can't look at everything. I try to, but that's why this requires a team. This cannot be done without our wonderful team, especially Alex. So.
That's what a nice compliment from Dr. Thors. Jennifer wants to know if Tammy has made any kinds of lifestyle changes or dietary changes now that she's on the other side. Is there anything you can't eat or can't drink because of this procedure?
No. And I'm pretty much doing what I've been doing, is trying to eat healthy and exercise. I really believe in walking and exercising on the treadmill for this condition.
Marge has a question for you again, Tammy. She wants to know, does Tammy know if these problems run in her family? What does she know about the possible causes?
Well, like Dr. Thors said, mine is radiation-induced rather than lipid-driven. But my father did die of a heart attack and had high cholesterol, high blood pressure, type 2 diabetes, and so I'm sure he had some arteriosclerosis too, you know. And
okay, so that could have been, well, and that was actually one more question we had from Jimmy was, how does the heart tie into all of this? We have a vascular surgeon on, so for our non-medical audience, we're talking about legs. How does that tie into the heart?
30% of patients with peripheral arterial disease will have some form of heart disease because the blood vessels, like we talked about, are not unique. They're all throughout your body. And so if you're getting disease in the blood vessels in the legs, it's very likely you could have that disease in the heart as well. And so it's important to, A, maintain a healthy lifestyle. We all know what's healthy and what's not. We all know we should exercise. None of us do it enough, et cetera. But also having a good relationship with your physicians, understanding if you've got predisposition to this disease like Tammy has in her family. It doesn't mean that you're going to get the disease. It just means that you have maybe certain genetic factors that make you predisposed to that disease. And so if you take the appropriate steps to, do the work ahead of time, hopefully you don't succumb to those problems.
And if you do, got Dr. Thors and Alex to help you out. As we wrap up this discussion, I'd love today's takeaways. Tammy, you're the one that approached us about coming on the show. You said you just wanted to talk about how Dr. Thors and his team gave you your life back. What do you want the audience to know?
This procedure has made such a difference in my life, and I'm enjoying life again, and it just has been so different for me. And like you said, I don't know how long it will last. It's a new procedure, but I have hope for the future now, and that's given me a lot of hope. And I'm just so grateful to Dr. Thors and Alex for doing the procedure. And it means so much when you have a surgeon that is going to do everything in their power to, make a procedure successful, and it just makes the future easier when you have a physician that you have so much trust and confidence in.
Reza, speaking of the future, when are you taking your lady out dancing?
Anytime.
You got to get on it. You got to make those plans.
Yes,
so I can see you're kind of emotional. You're so happy. You're not. You don't emote a lot. You remind me of my husband. But I can tell in your eyes that hearing your wife talk, it gets you kind of stirred up.
Thanks.
Alex, what do you want our viewers to know?
Just make sure that you're being healthy, getting active, as Dr. Thors says. Even though things are inside the body, you can't really tell what's going on. Trust your intuition. If you feel like something's wrong, come talk to your doctor. Might not be anything wrong, but it's better to be safe than sorry. And a lot of people get scared of these big surgeries, being cut on, things like that. There are less invasive options, as we've shown today. So if that's what's scaring you, don't let that keep you in an unhealthy lifestyle, unhealthy way.
These are options. And Dr. Thors, I'll give you the final thought of the morning. Anything else you want to say to Tammy and Reza, or let our audience know about the options out there?
This is why we do what we do. Okay, so we've just heard this morning, these are the things that make me work all night, every day, you know, to take care of these problems, to solve issues that were significant inhibitors to quality of life. Mm-hmm. And with future technology, with future things, I'm just excited for what we're going to be able to do and offer our patients. So.
Great story, great success story. Thank you all for being here and for sharing your journey, Tammy. We appreciate it. And thank you to our viewers for joining the conversation. Coming up tomorrow on the Morning Medical Update at 8 a.m., a beloved high school athletic director faced the toughest opponent of his life, cancer. But that diagnosis sparked a student-led movement and then a game plan for fighting back. Tomorrow at 8 a.m.